The wave of COVID-19 cases in northwestern Wisconsin is filling area hospitals to their capacity.
Evan Hong spoke with local hospital workers to learn more about the challenges they continue to face. That leads off tonight's coronavirus coverage.
We've been at or near capacity.
COVID is rampant in the community.
So yesterday we shared that we were 100% full.
That's the story across much of northwestern Wisconsin, as area hospitals struggle to keep up with an explosion of COVID-19 cases. Officials at HSHS hospitals say intensive care units have been at or near capacity in recent weeks, forcing patients to be admitted in the emergency room until beds become available. However, all local hospitals, including HSHS, say space is not the main concern, but a lack of staffing.
So it's a ratio. Do we have enough people with the right amount of skill to care for the patients that we have, and can we continue to take patients that need us? Can they continue to come here? And so it's a constant, how many balls are in the air.
The same is happening at Mayo Clinic, where over 300 staff are currently away from work due to COVID-19 exposure. For extra help, Mayo has called on nurses from all over the country to assist, and even retired nurses who haven't worked with patients in years.
So I will be honest, I haven't been at the bedside for 20 years. When we projected where we would be today, you need to have your blue scrubs ready to go. I have my blue scrubs ready to go, and they're on.
At Marshfield Clinic Health System, the beds are also filling up, and the workload is taking a toll on healthcare workers on the front lines.
Because the front lines is ugly. It is awful. It is nothing that, in my 20 years of being a nurse, I've ever wanted to see, and be able to leave those things at work and come home and raise a family is extremely difficult.
And if there's one message those on the front lines want to send to the community, it's to let everyone know that right now, the virus is more real than ever.
The things that we're seeing, I want the community to know that it is serious. So if Eau Claire and the Chippewa Valley can do anything to keep our beds open, our critical care beds, would be to wash your hands, wear a mask, stay at home.
That was our own Evan Hong reporting. Hospital officials still stress that no critical care patients are being turned away, but some people may be deferred to other hospitals on a case-by-case basis. All Eau Claire hospitals have a contingency plan in place for when beds are completely full and can take turns taking in emergency patients, so no single hospitals are overwhelmed even more.